Parents, you know the struggle. Your baby is congested, can't sleep, and you are exhausted. You've tried everything to help your little one, but nothing seems to work. Before you know it, you're wondering if an urgent care visit is the only option, along with the hefty bill that comes with it. But what if there was a better way, a more affordable way? Welcome back, friends, to the Healthcare Wayfinders podcast, where we are routing you to smarter, more cost-effective healthcare solutions. Today, I'm joined by Dr. Stephen Goudy, a pediatric ENT and founder of Dr. Noze Best. As both a surgeon and a parent, he saw firsthand how outdated tools to remedy infant congestion were failing families. So he created something better. His breakthrough device, the NoseBot, delivers hospital-grade suction in a simple, at-home solution, helping parents clear infant congestion, improve sleep, and avoid unnecessary medical costs. If you've ever wished for a way to help your little ones breathe easier without the stress of doctor visits and high medical bills, this episode is for you. Let's dive in. Dr. Goudy, thank you so much for coming on the Healthcare Wayfinders podcast. Welcome, sir.
Glad to be here. It's exciting, and I like to see you in person early in the morning, so this is perfect.
Yeah. All right, I need your help. I know you're a pediatric ENT. Can you tell me how to say that specialty name, Ontalala something?
Yeah, you almost had it. It's otolaryngology. So oto means ear, larynx means throat, and ology is just the study of all that. So it's ear, nose, and throat-ish. Or if you really want to get fancy, it's otorhinolaryngology. So it's, yes, or ENT
it's
is
that,
probably
ladies
a
and
lot
gentlemen.
better. Yeah, it's ENT.
That's crazy. I was trying to spell that out. I've even got it in Google, like, how do I say that? So super helpful that you did
ENT.
that.
You say that ENT. Yeah.
ENT, pediatric ENT. So I know you you founded a company called Dr. Noze Best at ATDC in Atlanta, which is a tech incubator that my company is a part of. But your office was across from ours, and just always loved getting to hear about what you guys were doing. And we've got one of your devices. I'll let you talk about it. But yeah, just love what you guys are doing and the work that you're doing, and wanted our audience to get to meet you. So tell me a little bit about yourself, and we can talk about your company and kind of see where we go from there.
Sure. Yeah. So I grew up in Kentucky, went to college, med school residency there, focused on ENT, as we discussed. And the reason I like ENT is because I get to see patients in the clinic as well as provide surgical interventions. It's a unique combination. And as an ENT, you can treat both adults and children. I chose to do a fellowship in pediatric ENT. So it was an additional 2 years. So by the time I got done, I was like 35, to focus on children. And so that's really what kind of got me to where I am today, is taking care of people's most prized possession, their children, and providing medical, surgical, and now innovations to improve the health and wellness of children. I have 3 kids of my own, and I think many physicians, and it's not specific to physicians, many people in the health ecosystem are not satisfied with the tools and available treatments for some specific issues. Dr. Noze Best, which is a company that's focused on pediatric health and wellness in the upper respiratory space, because that's what my area of expertise is, was really born out of my own personal experience being a parent and meeting with lots of families. So I get to do customer discovery almost every day, on the weekends, at night, when I'm on calls. The pain point that we chose to solve is that because babies have to breathe through their nose, and when they get a bad cold, they can't breathe, which means they can't eat, which means they can't sleep, which means you can't sleep, and potentially wind up in the hospital. There was not, at the time, a good way to solve the problem of nasal congestion in babies. And it's fascinating. Do you have kids or no?
I do. I have a 2-year-old and a 6-month-old, so I'm
Yeah,
right in this zone.
you're in the throes of it. And you went to Georgia Tech, which is one of the best schools in the country, yet you were sent home with a very complicated device with no IFU, no instructions for use. And that's holistically like what parenthood is. And we've been doing it for thousands and thousands of years. However, every parent goes through this discovery of this new bundle of joy And it's terrifying. And particularly when they get sick, it is heartbreaking. You're willing to do anything that you can to mitigate and alleviate the suffering. And if you're using 1940s, 1930s technology to solve a problem, which most of the devices on the market, before the NoseBot came to be, just not good enough. It wasn't good enough for me. And my wife turned to me and she's, look, you're a pediatric ENT. Why are we using stuff that's not evolved? I don't know. Just because we haven't focused on it. And I would say in general, our society does not focus innovation for children because the bigger markets are adults. And so that's really how Dr. NoseBot was born. It was born out of the desire to improve the health and wellness of children. And I'm not an engineer. I'm not smart like you. I just know what I know from medical school. And I know you did economics, but you went to an engineering school. So there's no way that you got out of there without understanding how to engineer things into being. So anyway, I'll stop talking, but that's how things evolved and you and I got to meet.
Yeah. So when my son's got a stuffy, congested nose, you saying this product you guys have called the NoseBot basically allows us to, I'm just going to say it in the words I know, get the snot out of his nose so that he can breathe. You can probably say it in a better way, but it makes him happier and he can sleep and we can sleep. And that's a huge value for me.
Yes. Yeah. And that's the whole goal in innovation, is to provide value, right? Like I'm not interested in innovation and entrepreneurship to steal wallet share and not provide value, right? And it's really offsetting the cost in healthcare too, because I know that your business is predicated on engaging folks to access the health system in a way that's meaningful to them and also reduces cost, because we can't have out of control costs in our health system, because then we all go broke and we're not delivering the value that we need. So putting solutions that are needed in the hands of the users, in this case, a parent that can to take care of your kid at home. People don't want to go anywhere anymore, right? Like everything you have, you want delivered to your door now. And so if I'm able to deliver to you the ability to clean your child's nose for them to be happy and them to breathe, that means you're going to be happy. Yeah. So I think that the democratizing access to health resources is what kind of aligns what you do and what I do.
And this device, it basically allows a parent to do what they'd have to pay to go see an urgent care specialist or come. This is a tool that normally is in the doctor's office or the hospital, or where would this tool normally be used?
Yeah, that's a great question. The idea was to provide hospital grade suction at home, right? Because to your point, people would go to the hospital because their kids couldn't breathe, couldn't eat, couldn't sleep. They get dehydrated and so on. And again, we're not making medical claims that like this will prevent you from ever needing to go to the hospital. If your child has RSV, there could be a whole host of issues, both in the upper airway, which is the nose, which the NoseBot does a great job of cleaning out. But in the lower airway, then that's a different deal. But it provides the parent with a tool that works much better, because it's not just the suction, but it's the way that the nose piece fits on your hand. So you can hold their face and suction their nose simultaneously. Because once they see you coming with these devices, it's like flossing the teeth of a saber-toothed tiger. Exactly. Right. And our goal, and we now have a humidifier that addresses the pain points of humidifying the air that children breathe, particularly because if they have a stuffed up nose, like you and I, we breathe through our mouth, your throat's dry, lower airway's dry. So our humidifier optimizes humidity specifically in the crib using multiple sensors in the room to control the humidity in the crib at 50%. And so really bringing technologic advancement to our children and providing scientific basis for that. Because I think in our society, unfortunately, there's lots of different types of information, but our company is focused on best practices, and addressing these silent suffering moments is what somebody once called them. Because when you're up in the middle of the night, it's 2 a.m., your kid's not breathing great, won't eat. That is a suffering moment that people don't really discuss. And so therefore it's silent. And we are focused on making parenting, I don't know that it's easier, but easier to do, right? Parenting is hard. There's nothing easy about it, but taking away the splinters or taking away the Lego pieces on the floor that you step on, right? If I can make those Lego pieces a little bit more round where it doesn't make your foot hurt really bad, that's my goal. And it's a virtuous cycle.
Yeah, totally. So is this device, is this something that like people have to get a script from their pediatrician to get, or how do people get it?
Yeah, it's a good question. And I would like to say that everything that's happened for Dr. Knows Best to be at the point where of the success where we are now was premeditated. I think it's been informed. There's been a lot of random lucky things that have happened, and certainly having people in the ecosystem that can help you, like the ATDC and others. We had GRA, which is Georgia Research Alliance, Biolocity. Lots of people helped us. I would say to answer that question, you buy it direct from Amazon or from our website or from Walmart because I knew what I did know is like working in a hospital. If I wanted a new widget, whatever it was, it has to go through a value analysis committee. 14 people think about it. There's not like that route is very long. And because I mortgaged my house to start the company, I was afraid that I would have to move out before we would get a sale. So because there are lots of nasal suction devices in the market, we can sell them direct to consumer. But that's completely separate from the other company that I've started, which is more of a med tech, a very long route to commercialization, which again is one of the barriers to getting therapies across the finish line because it takes an incredible amount of money and time, which maybe that's good. Being thorough is not a problem, but the business model that's predicated on adoption through hospitals and physicians in general involves tons of money and big fish swimming. And I'm a tiny fish. I'm not even a tadpole. I'm like plankton.
That's a good that's a good description. I can relate to that.
Yeah.
That's great. So somebody can just go on Amazon or go to your website and access these tools to help with their silent suffering, as one parent can say to another. That's great. For everybody listening, we'll definitely link to Dr. Knows Best and the NoseBot in the show notes so that they can check that out. You briefly mentioned a new company that you're working on. Can you tell us any more about that?
Yeah. So the name of the company is Iridivis, and it's based out of Oris, which means mouth, and Redivis, which is regeneration. And part of my life as being a surgeon is doing surgeries. And the good news is I can help people. The bad news is there's lots of healing and recovery. And one of the things that's less focused on, but we all can identify with, is oral wound healing, right? So if you've had a tooth pulled, like I had wisdom teeth removed and I got dry sockets, and that was super uncomfortable. And so I'm a surgeon that operates in the mouth and do cleft palate surgeries. I do tonsil surgeries, tumor removals, so on and so on. So that I see it, there's a use case, and all of the products that we use today to help improve oral wound healing are not indicated for that. So they're off, quote unquote, off label use, many of which are human derived. So there's the risk of transmission of illnesses, if you will, and a lot of them are not really, they're functioning as a barrier versus an instruction manual for the body to heal. And I have a research lab that's supported by you and the rest of the country. It's supported by the NIH. And we've focused on oral wound healing because there is a high rate, because if you think about the mouth, it's a dirty environment. There's lots of physical trauma, there's saliva, there's a whole host, teeth, all this stuff. And hoping that the body will heal in that environment I think is underestimated, and it usually goes pretty well. But if it doesn't, you start having food come out of your nose, your speech is funny, and you just have a ton of pain. There is a significant link to oral surgery, need for opioids, opioid dependence. So anyway, that's the soapbox. But the purpose of this company is to develop focused regenerative solutions to improve oral wound healing. And really what we're doing is harnessing the immune system using a repurposed FDA approved drug to control inflammation. So when wound healing happens, there's hemostasis, which means the blood clotting stops, or the blood clotting happens, so the bleeding stops. There's inflammation, so the body's bringing in the cells to clean it up. And then there's the repair and then the maturation part. So we're really focused on the inflammatory part and helping the body get enough inflammation so that it cleans it up, but not so much that it can't move on to the repair part.
Got it. And is this focused again on pediatrics, or could anybody use this?
As I said earlier, and I don't even know, unfortunately, but the facts are that the big fish, right? So I'm a plankton, you're a tadpole. The big fish, the Medtronics of the world, whatever, really evaluate different technologies in the addressable market, right? Like how much money can they put in the bank if they sell it one to everybody or what have you? And that's 80% of our society, probably 9. I don't know what the exact numbers are, but kids only make up a certain percent, say 20%, whatever it is. So that's not as exciting, but if I can get it approved for use in adults, then we can do that will de-risk it enough to do kids studies. Having said that, there are ways that the FDA has tried to lower the barrier and had quote unquote orphan diseases and whatever, which is a whole different thing. I'm not an expert in any of this. Like I said, you went to Georgia Tech, you're the smart guy and know all the smart people, where I'm just trying to figure out how to navigate. I understand when you have bad oral wound healing, it's not silent suffering, it's suffering out loud. So I understand that pain point. And again, I'm doing customer discovery all the time. I will say that my purpose is to bring these solutions to children because that's who I care about. I love everybody, but I choose to focus on children. And we as a society, I would think, say that we value the health and wellness of because these are the people who are going to be taking care of you and me. So we need to make sure that they're well taken care of. All that to say, the route to market will be the adult route because that's where the big fish are willing to take it. And then my goal would be to either, once it's available, you can use it off label and or do the pediatric studies depending on what big fish is going to push it across the finish line.
Yeah, that kind of makes me think of a saying that my dad has always had, which is there's no mission without any margin. And it gets back to, if you want to do something good or good work, like what you're talking about doing, oftentimes as a business, you have to design it to run and be scalable and sustainable and grow to the point where you can invest resources as much as you want in doing something that is maybe not as profitable, but is super important at the same time. I totally get that strategy. And that's definitely something that we do at Grassroots Labs to try to make laboratory testing as affordable as possible for folks. Help me understand a little bit. Let's say I had my wisdom teeth taken out and the doctors or the dentist says, don't suck on a straw or anything like that. But we go to Checkers and I get a Coke and accidentally forget it and it clot pops out. In theory, how would we use your product? How would I use your product to help with my out loud suffering?
Number one, I think it's obviously it's a very specific personal story.
Yep.
So there's no data to support that sucking on straws does or doesn't impact the clot popping off, right? So if you think about like wound healing, there's a clot, like you cut your leg, there's a scab, right? Same thing. And then that creates the scaffold by which your body starts to build things back. Right. That cleans up the mess. It's like you have a mess on the floor. You got to clean up the mess and then you got to start doing the repair and putting whatever new epoxy on the floor, or what have you. My goal with this therapy and what we do now with other therapies is we actually incorporate that in the procedure. Say I'm fixing a cleft palate and I'm worried that there's going to be a wound healing issue for X, Y, and Z reason. I will incorporate, meaning sew into place one of these other products that really doesn't instruct healing. It just acts as a barrier. So this is a degradable electrospun. So it's like a little fiber mat that you can sew into the wound and then it controls the wound healing from the inside out. And that would be the same use case for your wisdom teeth. Like you wouldn't have to worry about the matrix popping out because it'd be either sewn in there or secured in there in a way in which, we can determine what's the best use case for that, if that makes sense. Yeah. So I don't know. Number one, I personally don't like Checkers, so I'm not sure I would advise that. Nothing against Checkers. It's just not my thing. So, but after oral surgery, maybe not Checkers. Straw, there's no data to suggest. And it's almost gaslighting in some instances, like, oh, you did X, Y, and Z, therefore you're in pain and now you will suffer. And if only you hadn't done that, however many years later, you're thinking like, this was my fault.
Yes. Blame the patient, right? Although I did suck on the straw. No, if there had been something available to help me with that, it probably wouldn't have made such a big mark in my memory as a painful experience.
Yeah. Yeah. And again, the goal for us, and this is all work that has been supported by you, by me, by everybody else in our country. But our goals should be to improve, to leverage what we know to improve lives. And to your dad's point, you have to do well to do good, right? So Dr. Knows Best is a double bottom line company. It is focused on improving pediatric respiratory health and wellness. And the origin story is focused on a patient whose child, or a mom whose child had Down syndrome, looked at me one day in the hospital. Was like, look, I don't need you, doctor. I need the suction that's on the wall so I can clean my kid's nose and go home. Okay, I'm going to fix that. And the same thing here. If Iridivis does well, I go on mission trips to different countries and do surgeries on kids all over the place. And again, that alignment, the ikigai thing of doing what you're good at, what the world needs, what people are willing to pay for, and what makes you happy. I fully intend for that to be a central tenet in everything that I do.
Yeah, that's a great Venn diagram that we all want to work in. As we're finishing up, how long before what your research is doing do you expect to have something that people can use?
I'm an impatient person. Having said that, like I said, I know where the pain points are because I didn't have a checkers moment, but I had something similar to that. And so I am motivated by what I see is a gap. But from a regulatory standpoint, it really depends on the FDA and how our preclinical studies go and all that. But I have a whole host of other ideas that are farther up the pike that I want to see realized because there's other gaps. There's so many gaps, right? And if I'm able to have this little device in my pocket that coordinates my whole world, I feel like I should, as a surgeon, have more stuff at my disposal to make people's lives better. And I have no idea how long it'll take because I've never done this before, but I'm impatient and I don't like pain and suffering. And I don't like telling people, well, this is all we have. So my hope would be 5 years, but I have no idea, honestly.
Sometimes that all you can just say is the truth, right?
Correct.
Dr. Goudy, thank you so much for coming on the show today. It's been great talking to you, like always. Really appreciate your time and all the good work that you guys are doing.
Hey, no, I love what you're doing too. What you're doing, if you can keep people out of the ER, if you can keep people healthy, that's a virtuous cycle. I can't wait till you and I come up with some ideas that we can work on together.
I like that idea as well.
Yeah.
I really do.
Yeah. Yeah. Great. Thanks for your time today. It was great to talk.
Dittos. Have a good holidays.
You too.